Welcome back and thanks for staying with us. November is Pancreatic Cancer Awareness Month. Medical experts say pancreatic cancer remains one of the deadliest cancers in Jamaica and the world. Shamela Pullen tells us more in this evening's health report.
Pancreatic cancer happens due to abnormal cell growth in the pancreas. The pancreas is a small gland in the belly that helps control blood sugar levels and digest food. When these abnormal cells grow out of control, they form a tumor, which can lead to cancer. Dr. Lindbergh Simpson is a consultant general advanced laparoscopic and bariatric surgeon who sees a number of pancreatic cancer patients.
The most common sign of pancreatic cancer is jaundice, which is a yellow discoloration of the eyes. Any patient who develops jaundice or notices that their eyes are becoming yellow should go to the doctor because that is never normal. In pancreatic cancer, patients with jaundice also get a dark discoloration of the urine, and the stool also gets pale and cream colored.
Other symptoms include blood clots in the feet, weight loss, loss of appetite, and back pain. The condition is common among middle-aged people, but males are more affected than females. The cause of pancreatic cancer is still not known.
A couple of the main risk factors of pancreatic cancer include obesity and a history of alcohol use, or more likely abuse, or cigarette smoking. And unfortunately, these are things which we still have to a great extent in our population. So while it is on the increase, it still remains an uncommon cancer, but still a very deadly one.
Treatment usually involves surgery, chemotherapy, radiotherapy, and palliative care. But the prognosis is poor, especially if the cancer is at an advanced stage.
Unfortunately, more than 80% of patients are diagnosed at an advanced stage, and they have a much poorer prognosis. For patients who don't have surgery, care is usually palliative, where we try to minimize their symptoms, and those patients' survival is limited anywhere from 6 months to a year, depending on what their overall health status is and the disease burden.
With your health report, I'm Shamela Pullen, wishing you good health.